The normal blood pressure of an adult is 96 degree Fahrenheit, 97 degree Fahrenheit, 98.6 degree Fahrenheit, 99 degree Fahrenheit. The correct answer is option C, 98.6 degree Fahrenheit. The average oral temperature is 98 degree Fahrenheit, representing normal thermoregulation. The normal pulse rate in adult is 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A healthy adult pulse lies between 60 and 100 beats per minute. The functional unit of kidney is neuron, nephron, alveolus, axon. The correct answer is option B, nephron. Nephrons filter blood and form urine, regulating fluid and electrolyte balance. Next question. Normal blood pressure of an adult is 100 by 60 mm of Hg, 110 by 70 mm of Hg, 120 by 80 mm of Hg, 140 by 90 mm of Hg. The correct answer is option C. 120 by 80 mm of Hg is accepted as a normal adult BP. The normal respiratory rate in adult is 10 to 12 breaths per minute, 12 to 20 breaths per minute, 20 to 30 breaths per minute, 30 to 40 breaths per minute. The correct answer is 12 to 20 breaths per minute. First aid for heavy bleeding is apply ointment, apply direct pressure, wash wound, B. Give water. The correct answer is option B. Apply direct pressure. Direct pressure helps control bleeding quickly. The normal range of hemoglobin in females is 8 to 10 grams per deciliter, 10 to 12 grams per deciliter, 12 to 14 grams per deciliter, 14 to 16 grams per deciliter. The correct answer is option C. Option C, 12 to 14 grams per deciliter. Average HP in females 12 to 14 grams deciliter, in males 13 to 15 grams per deciliter. The main function of RBC is clot formation, oxygen transport, fighting infection, hormone secretion. The correct answer is option B, oxygen transport. Hemoglobin and RBCs carries oxygen to body tissues. Which vitamin helps in blood clotting? A, C, K, E. The correct answer is option C. Vitamin K is essential for synthesis of clotting factors. The normal pH of blood is 6.8, 7.0, 7.35 to 7.45, 8.0. The correct answer is option C, 7.35 to 7.45. Blood is slightly alkaline, maintained by buffer system. The functional unit of the nervous system is neuron, axon, brain, spinal cord. The correct answer is option A, neuron. Neurons transmit nerve impulses throughout the body. The main organ of respiration is heart, lung, kidney, liver. The correct answer is option B, lung. Lung exchange gases, oxygen and carbon dioxide. Pulse is felt due to heart contraction, valve movement, arterial expansion, venous flow. The correct answer is option C, arterial expansion. Pulse is the rhythmic expansion of arteries during each heartbeat. Which organ produces insulin? Liver, pancreas, spleen, stomach. The correct answer is option B, pancreas. Pancreas, beta cells of islets of Langerhans secretes insulin. The basic unit of life is tissue, organ, cell, system. The correct answer is option C, cell. Cell are the sectional and functional unit of all living organisms. The process of breathing in is called expiration, inspiration, inhalation, respiration. The correct answer is option C, inhalation. Inhalation, drawing air into the lungs for gas exchange. The main artery of the body is pulmonary artery, aorta, vena cava, carotid. The correct answer is option B, aorta. The aorta carries oxygenated blood from the left ventricle to all body parts. The human heart has how many chambers? 2, 3, 4, 5. The correct answer is option C, 4 chambers. Heart has 4 chambers, 2 atria, 2 ventricle for double circulation. The first cervical vertebrae is called axios, atlas, coccyx, lumbar. The correct answer is option B, atlas. Atlas supports the skull and allows nodding movement. The main function of the lung is pumping blood, gas exchange, food digestion, hormone production. The correct answer is option B, gas exchange. Lung exchange oxygen and carbon dioxide between blood and atmosphere. The pulse rate increases during sleep, fever, rest, cold. The correct answer is option B, fever. Fever raises metabolic rate and therefore pulse rate. The smallest bone in the body is femur, stapes, ulna, tibia. The correct answer is option B, stapes. The stapes in the middle ear transmit sound vibrations to the inner ear. The part of the brain controlling respiration and heartbeat is cerebrum, cerebellum, medulla oblongata, thalamus. The correct answer is option C, medulla. Medulla oblongata regulate vital involuntary activities like heartbeat and breathing. The bone protecting the brain is rib, skull, spine, pelvis. The correct answer is option B, skull. The skull cranium encloses and protects the brain. The largest part of the brain is cerebrum, cerebellum, medulla, pons. The correct answer is option A, cerebrum. Cerebrum controls intelligence, memory, voluntary actions. The fluid protecting the brain and spinal cord is lymph, cerebrospinal fluid, plasma, pericardial fluid. The correct answer is option B, cerebrospinal fluid. CSF cushions and nourishes the brain and spinal cord. Which is a hinge joint? Option A, shoulder, knee, hip, neck. The correct answer is option B, knee joint. permits movement in one plane, flexion and extension. The pulse felt in the neck is called radial pulse, femoral pulse, carotid pulse, temporal pulse. The correct answer is option C, carotid pulse. Carotid pulse is used during CPR to assess circulation. Normal range of respiration for a newborn is 20 to 30 breaths per minute, 30 to 50 breaths per minute, 50 to 70 breaths per minute, 70 to 90 breaths per minute. The correct answer is option B, 30 to 50 breaths per minute. Newborn breathe faster, about 30 to 50 breaths per minute. The universal donor blood group is A blood group, B blood group, AB blood group, O negative blood group. The correct answer is option D, O negative blood group. O negative blood can be safely given to any recipient. The study of tissues is called histology, cytology, anatomy, pathology. The correct answer is option A, histology. Histology deal with microscopic study of tissues. The main function of white blood cells is oxygen transport, clotting, immunity, energy storage. The correct answer is option C, immunity. WBC protect the body against infection. The largest part of the digestive system is stomach, small intestine, large intestine, rectum. The correct answer is option B, small intestine. Small intestine, site of digestion and nutrient absorption. The smallest unit of nervous system is brain, neuron, axon, synapse. The correct answer is option B, neuron. Neuron transmit nerve impulses. Which organ stores bile? Liver, gallbladder, pancreas, spleen. The correct answer is option B, gallbladder. The gallbladder stores and releases the bile produced by the liver. The condition of low blood sugar is called hyperglycemia, hypoglycemia, anemia, hypoxia. The correct answer is option B, hypoglycemia. Hypoglycemia, deficiency of glucose in bloodstream. The primary site of protein digestion is mouth, stomach, small intestine, large intestine. The correct answer is option B, stomach. Pepsin enzyme in stomach begins protein digestion. The enzyme that digests fat is amylase, lipase, pepsin, trypsin. The correct answer is option B, lipase. Lipase break down fat into fatty acids and glycerol. The normal range of blood glucose fasting is 40 to 80 mg per deciliter, 70 to 110 mg per deciliter, 110 to 150 mg per deciliter, 150 to 200 mg per deciliter. The correct answer is option B, 70 to 110 mg per deciliter. 14 glucose level is 70 to 110 mg per deciliter in healthy individuals. The average adult has how many bones? 200, 206, 208, 210. The correct answer is option B, 206. The adult skeletal has 206 bone providing structure and protection. The largest gland in the body is pancreas, thyroid, liver, and adrenal. The correct answer is option C. Liver aids metabolism, detoxification, bile production. The bone forming the forehead is frontal, parietal, temporal, occipital. The correct answer is option A, frontal. Frontal bone forms the forehead and upper part of the eye sockets. Which organ purifies blood in the body? Heart, kidney, lung, liver. The correct answer is option B, kidney. Kidney filters metabolic waste and maintain water electrolyte balance. Which blood cells helps in blood clotting? RBC, WBC, platelet, plasma. The correct answer is option C, platelets. Platelets or thrombocytes help form clots and prevent bleeding. Universal recipient blood group is O positive blood group, AB positive, A positive, B positive. The correct answer is B. The correct answer is AB positive. AB positive can receive blood from all groups. Universal recipient blood group is AB positive. AB positive can receive blood from all blood groups. Thank you all. The nerve that controls vision. Option A, olfactory, optic, facial, vagus nerve. The correct answer is option B, optic nerve. The optic nerve, second cranial nerve, carries visual impulses from the retina to brain. The sense of smell is controlled by olfactory nerve, optic nerve, auditory nerve, glossopharyngeal nerve. The correct answer is option A, olfactory nerve. The olfactory nerve, first cranial nerve, transmits smell sensation. The organ of ear is nose, ear, eye, tongue. The correct answer is option B, ear. The ear contains receptors for both hearing and balance. The functional unit of lungs is option A, bronchi, option B, alveoli, trachea, pleura. The correct answer is option B, alveoli. Alveoli are tiny sacs where gas exchange occurs. The process of removal of waste through urine is called filtration, excretion, absorption, secretion. The correct answer is option B, excretion. Excretion eliminates waste products from the body. The normal range of pulse for newborn is 60 to 100 beats per minute, 100 to 160 beats per minute, 70 to 110 beats per minute, 40 to 60 beats per minute. The correct answer is option B, 100 to 160 beats per minute. Newborns have a high pulse rate due to rapid metabolism. The largest artery supplying the brain is carotid, femoral, aorta, pulmonary. The correct answer is option A, carotid. Carotid arteries carry oxygenated blood to the brain. The white of the eye is called retina, cornea, sclera, iris. The correct answer is option C, sclera. The sclera is the tough white outer covering of eyeball. The colored part of the eye is iris, pupil, cornea, retina. The correct answer is option A. The iris controls the size of the pupil and gives eyes its color. The lens of the eye helps to detect color, focus light, produce tears, control size. The correct answer is option B, focus light. The lens focuses light onto the retina for clear vision. The normal human heartbeat about 50 times per minute, 72 times per minute, 100 times per minute, 120 times per minute. The correct answer is option B, 72 times per minute. The average resting heart rate for adult is 72 beats per minute. The valve between the right atrium and right ventricle is mitral valve, aortic valve, tricuspid, pulmonary. The correct answer is option C, tricuspid valve. Tricuspid valve prevent blood flow into right atrium. The human body contains approximately how much blood? 2 liters, 3 liters, 5 liters, 7 liters. The correct answer is option C, 5 liters. An adult has around 4.5 to 5 liters of blood. The normal specific gravity of urine is 1.000, 1.010 to 1.030, 1.040, 2.000. The correct answer is option B, 1.010 to 1.030. Indicates kidneys concentrating ability. The body temperature above normal is called hypothermia, fever, hyperpyrexia, pyrexia. The correct answer is option D, pyrexia. Pyrexia, fever, hyperpyrexia is more than 41 degrees Celsius. It is called severe. The normal respiration ratio between inspiration and expiration is 1:1, 1:2, 2:1, 1:3. The correct answer is option B, 1:2. Expiration lasts roughly twice as long as inspiration. The nurse should measure pulse per second if irregular. 15, 30, 60, 10. The correct answer is option C, 60 seconds. Count full minute to ensure accuracy in irregular rhythms. The most accurate site for core body temperature is oral, axillary, rectal, tympanic. The correct answer is option C, rectal. Rectal temperature closely reflects core temperature. Sterilization kills bacteria only, all microorganisms including pores, viruses only, fungi. The correct answer is option B, all microorganisms. Sterilization completely destroys all forms of microorganisms and spores. Disinfection destroys all microspores only, pathogenic organisms, virus only. The correct answer is option C, pathogenic organism. Disinfection eliminates most pathogens but not spores. The best method to sterilize surgical instrument is boiling, autoclaving, dry heat, chemical solution. The correct answer is option B, autoclaving. Autoclaving, steam plus pressure, ensures complete sterilization. Normal saline solution contains 0.45% sodium chloride, 0.9% sodium chloride, 1.8% sodium chloride, 5% sodium chloride. The correct answer is option B, 0.9% sodium chloride. 0.9% sodium chloride is isotonic with body fluids. The main goal of hand washing is soften hands, remove visible dirt, prevent infection, increase blood flow. The correct answer is option C, prevent infection. Proper hand hygiene breaks the chain of infection. The first link in the chain of infection is mode of transmission, reservoir, causative agent, portal of entry. The correct answer is option C, causative agent. The infection cycle begins the microorganism itself. The process of cleaning an area with soap and water is called disinfection, asepsis, medical cleaning, sanitation. The correct answer is option D. Sanitation removes organic matter before sterilization or disinfection. In CPR, the ratio of compression breaths in adult is 15:2, 30:2, 20:2, 25:2. The correct answer is option B, 30:2. 30 chest compressions followed by 2 rescue breaths. In case of burns, the first step is apply oil, cool with water, cover with cotton, break blisters. The correct answer is option B, cool with water. Cooling reduces tissue damage and pain. Fracture means dislocation, break in bone, muscle, tear, joint strain. The correct answer is option B, break in bone. A fracture is a partial or complete break in bone continuity. First aid for a fracture includes straightening bone, immobilizing area, massage, ice application only. The correct answer is option B, immobilizing area. Immobilization prevents further injury. Shock is high BP, low BP, and inadequate perfusion, fever, bleeding. The correct answer is option B, low BP and inadequate. Shock is failure of circulation that leads to inadequate tissue oxygenation. Oxygenation. Sign of hypovolemic shock is bradycardia. Cold, clammy skin, flushed face, slow breathing. The correct answer is option B, cold, clammy skin. Reduced blood volume leads to pulse, cold skin, and rapid pulse. In nose bleeding epistaxis, patient should be positioned head down, head tilted back, head slightly forward, lying flat. The correct answer is option C, head slightly forward. Leaning forward prevents blood from entering airway. The first step in case of poisoning is induce vomiting, identify poison, give milk, give water. The correct answer is option B, identify poison. Identification helps guide correct treatment. CPR should be started within how many minutes of cardiac arrest? 1 minute, 2 minutes, 4 minutes, 10 minutes. The correct answer is option C, 4 minutes. Brain damage can start after 4 minutes without oxygen. The main symptom of heart stroke is cold skin, sweating, dry, hot skin, shivering. The correct answer is option C, dry, hot skin. In heat stroke, sweating stops and body temperature rises dangerously. In frostbite, affected areas should be rubbed, rewarmed slowly, exposed to fire, immersed in ice. The correct answer is option B, option B, rewarmed slowly. Gradual warming prevents tissue damage. Artificial respiration means mouth-to-mouth breathing, blood transfusion, CPR only, injection. The correct answer is option A, mouth-to-mouth breathing. Artificial respiration supplies air to lungs when natural breathing stops. The first step in fainting is give water, lay patient flat and raise leg, give food, sit up. The correct answer is option B, lay patient flat and raise legs. Raising leg improves blood flow to the brain. The normal range of body temperature in degrees Celsius is 35 to 36, 36 to 37.5, 38 to 39, 40 to 41. The correct answer is option B, 36 to 37.5. Normal body temperature is 36 to 37.5 degrees Celsius. The condition of abnormal low body temperature is hypothermia, fever, shock. The correct answer is option A, hypothermia. Hypothermia means body temperature below 35 degrees Celsius. The best site for measuring pulse is in emergency. The best time for measuring pulse in emergency is radial, carotid, brachial, temporal. The correct answer is option B, carotid. Carotid pulse is strong and easily accessible during CPR. The vein commonly used for IV infusion in adult is radial vein, medial cubital, cephalic femoral. The correct answer is option B, medial cubital. Medial cubital vein is the antecubital fossa and most accessible. The nurse should check IV site for pain and swelling, temperature only, color only, BP only. The correct answer is option A, pain and swelling. Pain, redness or swelling indicates infiltration or infection. Normal adult systolic blood pressure range is 100 to 120, 80 to 100 mm of Hg, 120 to 140 mm of Hg, 140 to 160 mm of Hg. The correct answer is option A, 100 to 120 mm of Hg. Normal systolic is equal to 100 to 120 mm of Hg, diastolic 60 to 80 mm of Hg. The normal pulse pressure is 20 mm of Hg, 30 to 40 mm of Hg, 50 to 60 mm of Hg, 10 mm of Hg. The correct answer is option B, 30 to 40 mm of Hg. Pulse pressure is equal to difference between systolic and diastolic. The site for IM injection in adult is deltoid, gluteus medius, vastus lateralis. All of these. The correct answer is option D, all of these. All are suitable sites depends on drug and patient condition. Angle for IM injection is 15 degrees, 30 degree, 13 degrees, 45 degree, 90 degree. The correct answer is option D, 90 degree. IM injections are given at 90 degrees to ensure deep muscle entry. The angle for subcutaneous injection is 15 degree, 45 degree, 90 degree, 60 degree. The correct answer is option B, 45 degree. 45 degree allows drug to reach subcutaneous tissue safely. The angle for intradermal injection is 10 to 15, 30, 40 degrees, 90 degrees. The correct answer is 10 to 15 degree. Intradermal injections are shallow to form a small blood. The most common site for intradermal injection is upper arm, forearm, thigh, buttock. The correct answer is forearm. The inner forearm is ideal for sensitivity Montague's test. Thank you all. In hypertension, the blood pressure is below normal, normal, above normal, fluctuating. The correct answer is option C, above normal. Hypertension is defined as persistent elevation of blood pressure above 140 by 90 mm of Hg. The normal heart rate is in adult is 50 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 40 to 60 beats per minute. The correct answer is option B, 60 to 100 beats per minute. Normal adult pulse rate is between 60 to 100 beats per minute. The main symptom of myocardial infarction is headache, chest pain radiating to left arm, abdominal pain, fever. The correct answer is option B, chest pain radiating to left arm. Myocardial infarction causes severe chest pain radiating to the left arm, jaw, or back due to lack of oxygen to heart muscle. The drug used to relieve chest pain in angina pectoris is insulin, nitroglycerin, furosemide, diazepam. The correct answer is option B, nitroglycerin. Nitroglycerin dilates coronary arteries, improving blood supply to heart muscle. The normal respiratory rate for adult is 8 to 10 breaths per minute, 12 to 20 breaths per minute, 25 to 30 breaths per minute, 40 to 50 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. 12 to 20 breaths per minute is normal in adult. Inflammation of the liver is known as nephritis, hepatitis, gastritis, cystitis. The correct answer is option B, hepatitis. Hepat means liver, itis means inflammation, together called hepatitis. The main cause of peptic ulcer is excess food, Helicobacter pylori infection, lack of vitamins, alcohol only. The correct answer is option B, Helicobacter pylori infection. H. pylori infection and stress increases acid production leading to ulcer. Which electrolyte imbalance occurs in diarrhea? Hyperkalemia, hypokalemia, hypernatremia, hypocalcemia. The correct answer is option B, hypokalemia. Potassium is lost in diarrhea that leads to hypokalemia. The first heart sound lub is caused by closure of semilunar valves, AV valves, aortic valves, pulmonary valves. The correct answer is option B, AV valves, arterioventricular valves. Closure of mitral valve and tricuspid valve, AV valves, causes the lub sound. In burns, the rule of 9 is used to measure depth, estimate body surface area burn, measure pain, identify infection. The correct answer is option B, estimate body surface area burned. Rule of 9 helps estimate percentage of total body surface area affected by burns. The common symptom of appendicitis is left abdominal pain, right lower abdominal pain, upper abdominal pain, back pain. The correct answer is option B, right lower abdominal pain. Pain start around umbilicus and shift to right lower corner, we call MC Burner's point. The main symptom of diabetes mellitus is weight gain, polyuria, polydipsia, polyphagia, fever, cough. The correct answer is option B, polyuria, polydipsia, polyphagia. Classic trait of diabetes, excessive urination, thirst and hunger. Insulin is secreted by alpha cells of pancreas, beta cells of pancreas, adrenal gland, thyroid gland. The correct answer is option B, beta cells of pancreas. Beta cells of islets of Langerhans secrete insulin. The main symptom of anemia is blue skin, yellow eyes, pallor, and fatigue, rash. The correct answer is option C, pallor and fatigue. Low hemoglobin causes less oxygen intake, that causes pale skin and tiredness. The main symptom of anemia is blue skin, yellow eyes, pallor and fatigue, rash. The correct answer is option C, pallor and fatigue. Low hemoglobin causes less oxygen levels, that leads to pale skin and tiredness. The instrument used to measure BP is stethoscope, thermometer, sphygmomanometer, ECG. The correct answer is option C. The normal range of hemoglobin in adult male is 8 to 10 grams per deciliter, 10 to 12 grams per deciliter, 13 to 16 grams per deciliter, 17 to 20 grams per deciliter. The correct answer is option C, 13 to 16 grams per deciliter. The average hemoglobin level in adult male is 13 to 16 grams per deciliter, in females is 12 to 14 grams per deciliter. The main symptom of pneumonia is constipation, cough with sputum and fever, headache, leg pain. The correct answer is cough with sputum and fever. Pneumonia is an infection of lungs causing fever, productive cough and breathlessness. The causative organism of tuberculosis is Streptococcus, Mycobacterium tuberculosis, Staphylococcus aureus, E. coli. The correct answer is option B, Mycobacterium tuberculosis. Mycobacterium tuberculosis infects the lungs and other organs. The sputum test is done to diagnose heart disease, tuberculosis, liver disease, anemia. The correct answer is option B, tuberculosis. Sputum examination detects acid for bacilli or for TB diagnosis. Pulse oximeter measures option A blood pressure, oxygen saturation, heart rate only, temperature. The correct answer is option B oxygen saturation. A pulse oximeter measures the oxygen saturation in the blood. Normal oxygen saturation in healthy adult is 70 to 80%, 85 to 90%, 95 to 100%, 60 to 70%. The correct answer is option C 95 to 100%. Saturation between 95 to 100% indicate adequate oxygenation. The main sign of hypoxia. Cyanosis, bluish discoloration of lips, red face, sweating, fever. The correct answer is option A. Cyanosis, bluish color of lips. Cyanosis occurs when oxygen in blood is low, giving skin a bluish color. The bed position for a patient with breathing difficulties: supine position, fowler's position, prone position, Trendle, Trendelenburg position. The correct answer is option B, fowler's position. Fowler position or sitting up eases lung expansion and breathing. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased bilirubin. The organ affected in jaundice is kidney, liver, lung, heart. The correct answer is option B, liver. Jaundice occurs due to increased bilirubin from liver dysfunction. The yellow color in jaundice is due to option A, hemoglobin, bilirubin, melanin, cholesterol. The correct answer is option B, bilirubin. Excessive bilirubin in blood leads to yellow discoloration of skin and eyes. The main symptom of renal failure is increased urine output, decreased urine output, fever, sweating. The correct answer is option B, decreased urine output. In renal failure, the kidney cannot filter waste, leading to reduced urine. The most common symptom of urinary tract infection is E. coli, Staphylococcus, Klebsiella, Pseudomonas. The correct answer is option A, E. coli. E. coli from intestinal tract commonly causes UTI, especially in females. The main symptom of cystitis is headache, burning sensation during urination, cough, vomiting. The correct answer is option B, burning sensation during urination. Cystitis, inflammation of the urinary bladder, causes burning and frequency. Dialysis is used to treat heart diseases, kidney failure, liver cirrhosis, lung infection. The correct answer is option B, kidney failure. Dialysis removes waste and excessive fluid when kidney fail to function. The main symptom of heart failure is chest pain, swelling of feet, rash, headache. The correct answer is option B, swelling of feet. The main symptom of heart failure is chest pain, swelling of feet, rash, headache. The correct answer is option B, swelling of feet. Heart failure causes fluid accumulation leading to pedal edema. The pacemaker of the heart is AV node, SA node, Purkinje fibers, bundle of his. The correct answer is option B, SA node. SA node, sinoatrial node, initiate heartbeat. ECG is used to record blood pressure, heart electrical activity, brain waves, lung function. The correct answer is option B, heart electrical activity. ECG records electrical impulses of heart to detect arrhythmia or myocardial infarction. The normal respiration ratio of inspiration expiration is 1:1, 1:2, 2:1, 1:3. The correct answer is option B, 1:2. Expiration is normally twice as long as inspiration. The main symptom of asthma is option A, chest pain, wheezing sound and breathlessness, fever, cough only. The correct answer option B, wheezing sound and breathlessness. Asthma causes airway constriction, wheezing and shortness of breath. The first aid for nose bleeding epistaxis is tilt head backward, tilt head forward, lie down flat, apply ice to neck. The correct answer is option B. Leaning forward prevents blood aspiration into lungs. The common symptom of dehydration is excess saliva, dry mouth and sunken eyes, diarrhea, cough. The correct answer is option B, dry mouth and sunken eyes. Dehydration leads to fluid loss causing dry tongue, low BP and sunken eyes. The normal serum sodium levels is 100 to 120 milliequivalent per liter, 135 to 145 milliequivalent per liter, 150 to 160 milliequivalent per liter, 200 milliequivalent per liter. The correct answer is option B, 135 to 145 milliequivalent per liter. Sodium helps maintain fluid balance. Normal range is 135 to 145 milliequivalent per liter. Deficiency of insulin causes hypertension, diabetes mellitus, hypertension, anemia. The correct answer is option B, diabetes mellitus. Insulin deficiency leads to high blood sugar levels, that is diabetes mellitus. The hormone secreted by thyroid gland is insulin, thyroxine, adrenaline, estrogen. The correct answer is option B, thyroxine. Thyroxine controls metabolism and growth. Enlargement of thyroid gland is called goiter, cretinism, myxedema, hypothyroidism. The correct answer is option A, goiter. Iodine deficiency leads to enlargement of thyroid gland, goiter. The main symptom of hypothyroidism is weight gain, weight loss and restlessness, edema, fatigue only. The correct answer is option B, weight loss and restlessness. Overproduction of thyroxine increases metabolism, causing weight loss. The cause of tetany is deficiency of option A, calcium, option B, sodium, option C, iron, option D, potassium. The correct answer is option A, calcium. Low calcium level causes muscle spasms and convulsions, tetany. The common site for pulse checking during CPR is radial, carotid, femoral, brachial. The correct answer is option B, carotid. Carotid pulse is strong and easily felt during resuscitation. The most common symptom of meningitis is headache and neck stiffness, diarrhea, chest pain, rash. The correct answer is option A, headache and neck stiffness. Meningitis causes inflammation of meninges, leading to severe headache and stiffness. The causative organism of malaria is virus, plasmodium, bacteria, fungus. The correct answer is option B, plasmodium. Malaria is caused by plasmodium parasite transmitted by Anopheles mosquito. The vector for malaria is Culex mosquito, Aedes mosquito, Anopheles mosquito, sandfly. The correct answer is option B, female Anopheles mosquito transmits malaria. The incubation period of malaria is 1 to 2 days, 10 to 14 days, 20 to 25 days, 30 days. The correct answer is option B, 10 to 14 days. Malaria symptoms appear after 10 to 14 days of infection. The main symptom of dengue fever is joint pain and high fever, cough, diarrhea, skin rash only. The correct answer is option A, joint pain and high fever. Dengue causes severe muscle and joint pain called breakbone fever. The mosquito responsible for dengue is Anopheles Aedes aegypti, Culex sandfly. The correct answer is option B. Dengue is spread by the Aedes aegypti mosquito. The main symptom of typhoid fever is high fever with stepladder pattern, rash, vomiting, cold. The correct answer is option A, high fever with stepladder pattern. Typhoid shows stepwise rising fever caused by Salmonella typhi. Thank you all.